The Positive Pause is a motivational-minded podcast covering topics women want to know about as they journey to and through menopause, focusing on subjects that impact women's health and healthy aging, including what it means to age healthfully. The Positive Pause features experts and influencers from a variety of industries and specialties. The information and opinions expressed on the Positive Pause are not intended to replace the services of trained professionals or to provide specific medical advice. To see the National Menopause Foundation's full medical disclaimer, please visit nationalmenopausefoundation.org.
Welcome to the Positive Pause. I'm Claire Gill, founder of the National Menopause Foundation. Joining me today is Dr. Soma Mandal, one of America's top physicians in midlife women's health. Dr. Mandal is a board-certified internist who has helped thousands of women to successfully navigate getting older and reinventing themselves along the way. She prides herself on bringing a fresh perspective to the topic of women's health, skin health and aging, and particularly for women of color. Dr. Mandal is also the author of the book, Dear Menopause, I Do Not Fear You, where she takes a lighthearted approach to discussing everything surrounding menopause that many have been too shy to speak up about. She also hosts a podcast, Soma Says, where every week Dr. Mandal sits down with a guest and peels back the layers of issues that women commonly face, sharing unique stories and insights. Thank you so much for joining with me today, Dr. Mandal.
Thanks so much for having me, Claire.
So let's start off by talking a little bit about what made you want to enter women's health as your area of focus or expertise.
I think like many things in life, it found me. Because if someone had told me either in college or in medical school or even in residency that I would be focusing on women's health, I would have been like, this is not something that I had planned at that time. I had thought, okay, I'm going to be a dermatologist or go the route of internal medicine and take care of both men and women and perhaps figure out, what I want to do after that. But women's health was not on my radar. And it wasn't until I started my own practice back in New York City, where I had noted that a lot of women were gravitating towards me, and I started enjoying what I was doing, talking about the various issues, infertility. And at that time, I was younger, and my patients tended to be younger. Mm-hmm. So I was helping them figure out how to get pregnant, who to see, who the best doctors were for those kind of things. And as well, doing all the things that an internist does in terms of helping their patients. But as I started getting older, and my patients were also getting older with me, and older women started gravitating towards me. And that's when I really started focusing in on midlife issues, like obviously menopause, but all the other things that come with that. And I'm talking from a medical perspective, but I haven't even mentioned my own experience when it comes to being just a patient. Let's leave out the MD after my name, where I felt that if I wasn't a doctor, how would I have navigated the various issues of infertility that I have faced, the various health issues that I have encountered. And I had to really advocate for myself. And I'm not someone I do now, but at that time, I'd never walked into a room and say, I'm Dr. Mandal.
Right. But even you have to, right? I think that's what's so important for women to understand. One, doctors are people too, but also exactly like you said, the lack of understanding and education and awareness around women's midlife, women's health, but midlife health in particular, is so prevalent that even doctors themselves have to figure it out.
Yes. And I trained at the time when the Women's Health Initiative came out. And I talk about this all the time. It shaped how I practiced as a doctor because I was in residency and we were told you can't prescribe hormones anymore because it's dangerous. It causes heart disease. It causes strokes. It causes breast cancer. So I grew up in an era where the women that were around me didn't receive hormones anymore. And I was used to that. that became part of my language. Okay, well, you shouldn't be on hormones. You shouldn't be on hormones. So all these things really shaped who I am, not just as a doctor, but who I am as a person, because it wasn't just me. It was my mom, my
Yeah.
sister, my friends, where I really had to be the advocate and say, well, you have to approach your doctor and say, I need a calcium score because I have a family history of heart disease. I know I'm just 45, but I need one because, I have a parent. And so just really helping my friends, my own patients, myself, my relatives, I realized that I'm more than just a doctor. I am an advocate. And I've really instructed people around me, my own family, my patients especially, that you really have to speak up for yourself. You can't take no for an answer. If you
Yeah.
get a negative response from a doctor or a nurse practitioner or whoever it is, and you believe that this is something that you need to fight for, then you should do it. And I've helped patients do that as well.
That's great. But I think, like you said, it's the time that we came into this stage of life and how drastically things have changed over the course of the last 20 years. But knowing what we know now, knowing what the science shares, now it's a time that we have to do all kinds of re-education for both the clinicians who aren't learning about it, as you said, in medical school. They would just sort of skip that when there was nothing to treat with. There was no point in studying it, right? There were so many other things that were coming on the market that clinicians and doctors needed to know about. And so those became the focus, and menopause and hormone therapy and all of that just sort of went by the wayside. And so now that we're at a different stage in understanding about the importance of hormones and the efficacy and safety of hormone therapy, it means we have to go back and sort of redo all of that education for both, like I said, for both the clinical community and for patients themselves. I love that you said that people sort of gravitated to you in your practice. And it makes sense then that you went on to host your own podcast talking about these issues, because when women find someone like you who they feel like they can relate to, they feel like they can talk to about these issues, then they tell their friends, they tell their family, and then more and more and more want to know and have access to clinicians who really take the time to help explain and understand. So before we talk about your medical practice, I want to talk a little bit about Soma Says and how did that come about and where can people find it? We'll make sure we link to it with the episodes of, with this episode, but tell me a little bit more about how that came about.
No, thank you. Thank you for promoting my podcast. It started for the love of sharing knowledge. And it was something that I realized at this age that I loved to share knowledge and educate people and advocate for women even back then. So when I was in high school, I used to be an associate editor of our high school newspaper. And the title of my column was called Soma Says. And so I would write about the inequalities of girls only having to take home ec and why boys had to, were able to skip it. And the boys were not happy with me. So the topics range from that to getting a traffic light in front of our high school for safety, to how unfair it was that we had a homecoming queen and how antiquated that was. And I wrote about those kind of things. And I realized that I had a passion for it. Honestly, Claire, medical school takes the life out of you. And so all those things just kind of disappeared for me.
Right.
And I forgot about it because I got wrapped up in my career. And at some point I realized that I need to bring that back. That's what gives me true joy in doing what I do. So that's when I started the podcast. And I'm grateful and blessed because there's very little I have to do to get people to talk to me. Like people ask me to be on my podcast. And when I first started, it was almost like when I first started my practice, how many years ago? I'm like, who's going to want to see me? Right. And that blossomed. And the same thing with my podcast. And I enjoy it so much. And what I never realized that I would learn so much from my guests, that it's opened up a whole new world for me. And I'm so grateful for that. So a lot of my patients listen to it, people all around the world, which is so flattering. And it's mind boggling that, like people all over the world are listening to this one podcast that I created,
That's awesome.
that I host out of my own house. And we talk about various topics, obviously menopause, but prevention of heart disease, talk about Alzheimer's and how to help women with various struggles that, like urinary incontinence and all sorts of stuff. But my guests were wonderful. I've learned so much from them, and I think my listeners have too.
That's awesome. Like I said, I make sure that we link to it with the notes from this episode. And I think I have a sort of love-hate relationship with technology most of the time. But I think what's so wonderful about it is this opportunity to connect with experts and have these conversations, and that we can listen to it on the go when we're busy and, we're not tied to our computers or to a television or to whatever, to be able to kind of have access to some of these fabulous people. And I joke all the time that I can't stand the sound of my own voice. So I don't listen to these podcasts after I record them with all of you. But I'm thrilled too that I always say that the purpose is more important, right? It doesn't matter that I care about what I sound like or what I look like. It's the message that matters. And so having people who are listening have access to experts from all across the country, and then, like you said, people listening in from around the world, makes such a difference. And I love that you're bringing that joy of education and connecting to everybody through your podcast. So you're also doing that in your medical practice. And so I understand that you're working on opening a women's health center at the hospital where you're based. So let's talk a little bit about that in particular, how it's coming along, and kind of what motivated you to do that. And then also why having women's health centers are so important.
Of course, of course. So I'm currently transitioning out of my current role where I work as an internist. And I've been at my current practice for the past 11 and a half years. I'm grateful for everything that I've learned and all the different doctors and patients that I've encountered. But starting at the end of January, I am the incoming medical director of women's health at Hackensack Meridian Health, specifically at Jersey Shore University Medical Center. And there are a lot of talented people there that I am eager to work with. And we want to level the game when it comes to women's health. That I'm not sure if I'm allowed to say this, but we're not just our vaginas, right? We are a unique set of individuals. Women's health is not anything like men's health. We have so many different health challenges that are so unique. And so it can't just be a primary care doctor who manages these issues. It needs to be a whole team of doctors who work together, who really not just have the passion, but the understanding of how women's health works. And so we aspire to have cardiology on board, endocrinology, obviously gynecology, primary care physicians like myself, a whole spectrum of doctors, specialists like behavioral health, because as you know, during menopause, anxiety and depression can be real things, and those need to be addressed, and women need to be helped. So we aspire to build a whole team, a whole panel of doctors, specialists who can help navigate women during this transition, and also help them with other things. Like, for example, women struggle with being in the sandwich generation and the stress of that. And often they just feel lost. So a lot of times I'm like, have you spoken to a social worker about the problems that you're having? These are simple solutions that often people don't realize they have access to. So it's really, hopefully will help women across the board from as early as 18 to my oldest patient in life was 104. So I hope to help patients at that age as well.
That's what's so incredible about being an internist, right? Is that you really are from birth to grave when it comes to helping your patients and being part of their lives. It can extend all throughout that time frame. And I just echoing what you said about the unique challenges of women's health. And I'm always fascinated when I talk with people about those unique challenges that we have for women's health. It just reminds me what incredible beings women are, right? Like they're so complicated. And unfortunately, because of that complication, there's not enough research done to study women's health because it becomes too expensive. And that's just not acceptable, right? We, as more than half the population of the world, deserve to have a focus on our health and our well-being that allows us to thrive in our longevity these days. We're living longer, but we're not living healthier. So I love that you're really pulling together all of those things in that women's health center, and for women of all ages, right? This is not a midlife women's health center. This is a women's health center that you're starting, right?
That is right. Because I've been through my own set of health issues prior to midlife, and it takes unique doctors and unique specialists to understand that women's health is different from men, and that knowledge needs to be there. And I hope that we can do that for women across the board.
So curious to think, what are some of those challenges that you think arise when you're trying to focus on a women's centric health center? And two, why this hasn't been done before?
It has been done. There are places like, for example, the Northwell Katz Institute, which is out in Long Island in New York. They have an excellent model of women's health care. They have a whole center devoted to taking care of women. But even though they are the beacon of doing this, we need more. We need more places across the board to have centers like this to take care of women.
I meant more like I realize I do know that there's other women's centers, and there's a lot of women's midlife centers or menopause centers popping up now, right? Because that's become a focus. I'm more like, I can't believe that's taken to, the last decade or so before people are like, oh, hey, women are unique and we should have specific systems or centers focused on them. But also then it seems that they're not sustainable. Right. So what are you guys doing for some reason? And I think at least the midlife women's health ones, I know those are conversations we're having, how to make them systemic versus just a champion who says, I'm going to run a midlife women's, a menopause center. And then if she or he retires, the whole thing falls apart. Right. So what are some of those challenges with bringing all of those different disciplines, like you said, together? We're very siloed in America's health sector. How are you working to bring all of those different specialties together in this women's health center?
The challenges are always, if you're working in an insurance-based model, obviously that model is always difficult to navigate through because of payment. But the bottom line, it always comes back down to money. And even in a primary care model, that is always a challenge with dwindling reimbursements.
Mm-hmm.
So you have to bring in not just patients, be able to bring in patients, but make it attractive to them. And I firmly believe that education is part of that. So there are things that you may need to do, like have lectures, have demonstrations, have fairs where you're not necessarily making money per se out of those things, but you're helping to educate women, and that they want to then come in and take care of themselves, or that might inspire them to tell their sister or their mother, hey, there's this great place that you can come to that addresses everything. And because of the lack of the one-stop shop kind of place, women don't necessarily know. We were talking about this earlier, how to navigate across, maybe even in the same system. I had a patient today, for example, who had a diagnosis of cancer, and she kind of just got lost. She didn't know who to see. And so if you have a bunch of doctors who know how to deal with that, that can connect you to that specialist, maybe in that same office, it makes it much, much easier for the patient themselves.
Yeah. Like I said, it is so time consuming. And then the patient is often, again, when you get a referral to another specialist, that's another time off work, or that's another need for
Yeah.
a babysitter.
Yeah.
That's another kind of thing that you've never really talked about. We just sort of assume that, and women do, we just navigate it all and figure it out. And if you're lucky enough to have time or take time out for your own health kind of stuff. So it makes perfect sense that this is a better way to do it. What can we, as like patient advocacy organizations and as patients ourselves, what can we do to help promote this method of care for women, or this pathway of care? What's our role in ensuring that these types of practices continue to thrive?
I think podcasts such as this are very, very informative for patients, because just like you said, that this is something that on the go they can listen to while they're commuting in their cars, or just listen on the fly. But also the advocacy work that you do with educating women. Half of what I do as well is educating women about osteoporosis, about getting their bone densities earlier than, we're told to get our bone densities at 60. Why? You're already going to have like far
Wait.
set osteopenia or osteoporosis by then. What about the preventative
Yeah, we have
aspects?
so much work to do.
And that's the part that I think is sorely lacking when it comes to women's health, where we need more advocates like you that talk about these things, that help educate women so that they know, okay, Claire has talked about this, and I need to get my bone density earlier. And you help educate patients, and you also help them know how to advocate for themselves, because unfortunately, and I'm not saying that they're bad doctors, but there's still doctors who say, no, you know what? Don't get your bone density yet. Wait until 60.
Yeah, there's no point. You don't need it. Yeah, we hear that all the time.
And that's the part where I tell my patients, don't be black and white in that situation, because we also need to help educate those doctors. They're not bad doctors. They just need to be educated. And the patients also have a part in that, where I'm like, you can show, now we have AI, and if you use it properly, they can gently say, well, this is a research article that I read that advocates for me getting a bone density
Right.
earlier, or Dr. Mary Claire Haver has advocated for that. Do you know who she is? And there are plenty of things that she, for example, does on social media that teach women how to advocate for
Yeah.
themselves. So we need more doctors and people like yourself who can really educate women to know these things, because I still feel like most of my patients don't know. And so when I say, let's get a bone density, and they're like, well, I'm only 50 years old and I'm still having my period. I'm like, okay, let's talk about why.
Right.
Right. And
History.
so that's one. Yeah. And then that gets passed down to their friend or their sister. Right. And so you're spreading knowledge, not just to that one person, but to their contacts as well.
That's one good thing, right? That women do really well. When we learn something new, or we have an experience, a lived experience ourselves, everyone's all about sharing it now, right? And I love that that has changed so dramatically in our society, where I remember when people didn't say cancer, you said the C word, right? Because you didn't even talk
Right.
about cancer. It was private, and it was, again, negative, and people didn't talk about it. And so we've come so far. Now here we are again talking about menopause, talking about vaginas as a part of a human anatomy, with not calling it some funny little name, but actually helping women understand how their bodies work. And so all of that is good. And we need to make sure that women have access to this information, and that they can make good choices for themselves based on the information they have available. But they can't do that if the information is not available. And so Same with your podcast, right? This is like the way to kind of get to people and say, hey, it's all right to ask questions. It's all right to stand up and say, I want to learn more about this. I want to pursue this. And if you're not comfortable talking to me about it, Dr. whomever, as you said, not bad doctors, just so little time they have now to focus on the patient. And the way things are changing so dramatically, like just as we said, if you're an internist, you're from birth to grave, how could you possibly keep up with all the advancements happening? And so we need to give some grace too, and realize that if you have a clinician who you're comfortable with, who's just not able to address your needs in one area, it's okay to talk with them and say, I totally get it. This isn't in your wheelhouse. Can you recommend someone else to me? Or that kind of thing, to really be able to focus on what the patient needs. It's going to take a lot of effort because there aren't enough clinicians to treat all of us at the moment anyway, right? And so we need to do a better job of being able to support that kind of stuff. I'm curious, one of the other, following back up on the Women's Health Center that you're developing, people often ask me on the menopause side, right? Okay, where do I go to find a menopause certified specialist? And so that's easy. You go to the Menopause Society, go to menopause.org. They have a list of clinicians who are certified. There's a lot of other clinicians who focus on menopause who haven't gone through the certification, but at least that's one resource. Is there like a collective resource of women's health centers in the country?
As far as I know, no. I mean, in what we call the tri-state area, New York, New Jersey, Connecticut, I'm very familiar with what's in New York and a little bit of what's in New Jersey. But as far as I know, I don't think there is one collection or database of women's health centers for the United States.
That would be really useful. We'll have to work on that because I think, again, being able to help drive women to these centers, if they're available in their community, will go a long way to, one, making them sustainable, and two, demonstrating to hospital systems and administrators that there's a need and a desire for this type of care. I think that's going to be super, super important. It's hard to say like, oh, if I didn't even know you existed, right, is not going to get your practice thriving. And we want to make sure that they thrive because we need, like we said, we need more of them. So we have to make sure the ones that are in existence are at capacity.
That's right. That's right. And that's why I'm grateful for platforms like such as yourself, where you are able to highlight all not just the different conditions and stuff, but you are able to showcase the various doctors and specialists that work with women and can help them.
So I'm curious, Dr. Mandal, let's say, besides hormone therapy, which I imagine is a huge question for women at midlife, what's another big question that you're that maybe even surprised that women ask about at midlife that they don't yet know about?
It is something that I talk about on a daily basis and maybe 4 or 5 times a day. The number one killer of women is heart disease. And I talk about it all the time. And I advocate for women to get screening when it's appropriate. I take a detailed history of their family. I educate them, even if they say, well, my cholesterol's fine. Mm-hmm. I tell them about the latest research that's out there, what to do, how to screen for yourself, what to watch out for. And there's like a gold mine of information in your own family that a lot of people don't even know.
Right.
And I'm like, while your parents are still alive, if you're blessed that you still have your parents around, this is a time to sit down with them and talk to them, not just about their own history, because a lot of them come from generations where they didn't talk about their health. So this is a time where it's important for them to be like, you know what, you may not want to disclose it to me, but I need to know for my health as well as my kids, your grandchildren, what you have, what grandpa had, what grandma had, so that I'm aware what to look out for.
That's so important. That's so important. And like you said, sometimes it's a cultural thing too, where parents don't talk to their children about it, or it's just health isn't discussed in that way. But as you said, presenting it in a way that explaining the importance of family history and what a huge role genetics and heredity have on our health is a great way to get people talking about it.
Absolutely.
Yeah. And so true about heart health, right? I'm often comparing osteoporosis and cardiovascular disease, and saying how, hey, we have a pathway for cardiovascular, we don't have a pathway for bone, and we need to. But again, the sheer numbers of women who succumb to heart disease or heart attacks is just absurd in this day and age. And we have to do more to educate people about that. So I'll make sure with this episode, we also include links to the American Heart Association and all of the great work that they do to try to help educate women about heart. I'm surprised that, that's so interesting that you talk about it so often, because I feel like, again, maybe it's in my bubble of being in the women's health space that, like, doesn't everybody know by now that women is the number one killer? That, that
No.
heart disease is the number one killer of women?
No. And that's the sad truth, that they don't know.
Wow.
I think we get caught up because we're often the caretakers, right? We're taking care of our parents. We have children. We're making sure they're getting into colleges or whatever stage of life they're in. And we often forget about ourselves. Oh, I'll take care of that later. Oh, I'm fine. I'm not having chest pain. My cholesterol's fine. I don't have blood pressure issues. Yeah, but your dad had a heart attack at 50.
Yeah.
And these are not things that I'm making up. These are actual conversations I have with patients. So it's very easy to forget yourself in those kind of scenarios and not realize that you're at risk.
So heart disease, again, not people knowing that. It's just incredible. It's incredible. Okay, so I'd love to know then, we've covered a lot. And I think, again, really want people to know more about women health centers, what's available. I'm going to follow up on that and see, like, if I can find sources or work to make sure someone creates it where women can identify where they can go in their community where there's a women-specific health center. But what's one thing, Dr. Mandal, that you want our listeners, women, to do to pay attention to their health? What's one thing that would be a helpful, do this today?
Put yourself first. And that can mean having to maybe have your spouse or partner do a certain chore or take care of the kids' activity, whatever it is, but put yourself first, perhaps for a 30-minute walk, perhaps for taking a relaxing bath, perhaps for doing a 15-minute meditation. Notice that I'm not talking about whole day things, perhaps for getting your physical scheduled, all sorts of things where you can put yourself first, but you can't do it alone. You need to call in the guards and get people who can help you with those things as well.
That's a great advice. That is great advice. I've said this several times. It was someone, just put yourself on the list, right? We're not even on our own priority list. And I keep sharing that recently with people. Like, man, when it comes to taking care of ourselves, we're not even on our own list.
That's right. And so there's so many ways that you can put yourself first that I didn't list everything, obviously, but that's the number one advice I can give to women across the board.
I love that. Thank you so much, Dr. Mandal. Thank you for sharing your time and your expertise. And as I mentioned, we'll have links to all the resources about you and your work with the notes of this episode. I hope everyone has enjoyed this episode. And if so, please subscribe to the Positive Pause podcast so you never miss an episode. Please find Soma Says and subscribe to Dr. Mandal's podcast as well. And please share the information with your family and friends. Thank you again to my guest, Dr. Soma Mandal, physician, author, and podcast host of Soma Says. And thank you for listening. We hope you'll tune in to another episode of The Positive Pause.